Hey man, what's up? I'm here at the doctor's office. Hey, let me call you back, bro. They
Hello,
coming in.
Mr. Arnold.
How are you, madam?
My name is Nurse Dion, and I'm going to be doing your physical assessment for today. I'm closing the door, and I'm closing the curtains for privacy. I'm washing my hands. Mr. Arnold, can you tell me your full name?
Davia K. Arnold.
And do you know what month it is?
November.
And do you know where you are, Mr. Arnold?
Here at the doctor's office.
Good. Patient is able to speak and hear. Skin is within normal limits. Patient is well nourished and medium built stature. Posture is good. Patient is sitting up. Mr. Arnold, can you stand up and down out of your chair? Move your arms around, legs. Warm up a little bit for me. And bring your legs up at the same time as you're moving your arms. Thank you. You can have a seat. Patient mobility is good. So, Mr. Arnold, we're going to go ahead and get started with your physical assessment. I'm going to first start with your head. Then I'm going to go in and examine your eyes, your nose, and your mouth. So I'm going to warm my hands up a little bit because I don't want them to be cold when I touch you. And I'm looking for any bumps. No bumps indicated. Does that hurt when I touch?
No, ma'am.
None tender to touch. Scalp is intact. No lesions. No redness indicated. Mr. Arnold, can you clench your teeth for me? Can you squint your eyes? Give me a nice big smile. Pretty white teeth. Can you blow your cheeks out? Face is symmetrical. Now, Mr. Arnold, we're just gonna go into examining your eyes. You're gonna see my pen light just shine in on your pupils. Pupils are equal, round, and reactive to light and accommodations. And what I want you to do is look forward at my pen. Don't move your head, but follow my pen light with your eyes, okay? Okay, now you're gonna stay there, and you're gonna see me draw my pen light in towards you. Don't move. Eyes are accommodated. And I'm just gonna go in and check your conjunctiva. Nice pink and moist. Sclera is white. Now what I want you to do for your nose is hold one nostril and breathe out the opposite. Good, now switch. Good, nose is painted. If you could tilt back for me, we're gonna take a look into your nostrils. No lesions indicated. Nose is dry. Nasal septum is non-deviated. And if you can open your mouth for me, hold your tongue out and move it from side to side. Good. Buccal mucosas are pink and intact. Say ah.
Ah.
Good. Tonsils are nice. Palate is soft. No lesions indicated. If you can lift your tongue up for me, very good. Now bring your teeth together. I just want to take a look at your gums. Give me a nice big smile. Yes, gums are pink and intact. Lips are pink, moist, and no cracks are indicated. So, Mr. Arnold, I just want to take a quick look into your ears while I have my pen light out. I'm going to touch. Does that hurt when I touch?
No.
No redness indicated, none tender to touch. I'm just going to slightly pull up and back. No drainage noted. And I'm just going to check the other side. Does that hurt when I touch?
No, ma'am.
Okay, I'm just gonna pull up and back. And no drainage is indicated. Ears are symmetrical. And I'm gonna go in and we're just gonna check your sinuses, your maxillary and your frontal sinuses. I'm just gonna press press down slightly. You let me know, palpitate here. Do you feel any tenderness?
No.
None. Tender to touch. And I'm just gonna go in and check your frontal sinuses. Does that hurt, Mr. Arnold, when I palpitate there?
Not at all.
None. Tender to touch for the frontal sinuses. Very good. Now what I'm gonna do, Mr. Arnold, is we're gonna go in and I'm gonna check your mastoid, and I'm gonna also check some of your lymph nodes, okay? I want you to open wide for me here. Very good. You can close. That is symmetrical. We're just gonna check your lymph nodes. Does that hurt when I touch?
No, ma'am.
Okay, lymph nodes are non-tender to touch. They are movable. They are symmetrical. And they are soft. So you're gonna feel me go on down. Carotid pulse is palpable. Trachea is midline. Does that hurt, Mr. Arnold?
No, ma'am.
Non-tender to touch there. What I would like for you to do at this time is swallow for me. Good. I'm gonna come around to the back. Does that hurt, Mr. Arnold?
No, ma'am.
When I touch, very good. Trachea is midline as well. Non-tender to touch. Now, Mr. Arnold, I just want to check your range of motion. So if you can just move your head for me side to side. Range of motion is good. So now I'm just gonna warm my hands up a little bit. I'm gonna place it on the side of your head. I want you to push against my hand and checking for your strength. Push for me. Oh, very good. Strength is good. And I'm gonna check the other side. Push against for me. Strength is good. Your physical assessment, Mr. Arnold, is complete. The doctor will be in with you shortly.
Thank you.